Welcome to The Deep Dive. Today we're pulling back the curtain on, well, one of those hidden parts of our own bodies. An organ you probably don't think much about until, well, maybe until it really demands your attention. We're talking about the pancreas. Yeah, it's kind of an unsung hero working away behind the scenes. So our mission for this deep dive is to get into the nitty-gritty of pancreatitis. We'll look at the two main types, acute and chronic. What causes them? What are the signs? And, what does it all mean for your health?
Exactly. And I think before we jump into what goes wrong, it's helpful to understand what the pancreas actually does. It's a pretty amazing organ, really. It has two big jobs.
Your jobs, okay.
Yeah. First, there's the exocrine part. This is where it makes powerful digestive enzymes, and also bicarbonate, which helps neutralize stomach acid. It pumps those right into your gut to break down food.
Okay, so crucial for digestion.
Absolutely crucial.
Yeah.
Then second, it has an endocrine job. This means it makes hormones like insulin and releases them straight into your bloodstream. And, as well, most people know, insulin is key for managing your blood sugar.
So it's juggling digestion and blood sugar. That's quite a balancing act.
It really is. And that dual role, well, it also means there are different ways things can go wrong, which kind of sets the stage for pancreatitis.
Okay, so let's start there. What happens when this vital organ suddenly, flares up? You mentioned acute pancreatitis. Is that like a sudden attack?
That's exactly it. Acute pancreatitis is this sudden, sometimes really dramatic inflammation of the pancreas. Occasionally, it can even affect the tissues right next to it.
Inflammation, okay.
Right. And the key thing is the severity can vary hugely. It might be quite mild, something that clears up relatively quickly, or it can be extremely severe, life-threatening, needing intensive care.
Wow.
But importantly, unlike the chronic type we'll talk about later, acute pancreatitis is usually something that resolves. Think of it like a sudden storm, but a storm that hopefully passes.
A storm. I like that analogy. So what kicks off this storm? What are the common triggers? Are there some surprising ones?
Well, the two biggest culprits are pretty well known. First, gallstones. They actually account for a really large chunk, maybe 40 to 70% of cases.
Gallstones. How do they affect the pancreas?
Imagine a tiny stone getting stuck in the common duct where the pancreas releases its enzymes. It causes a blockage, a backup, and that triggers inflammation.
Okay. Makes sense. What's the second big one?
Alcohol. Heavy alcohol consumption is linked to about 25 to 35% of acute cases. But yeah, beyond those two, there are definitely other causes that can surprise people.
Like what?
Certain medications, for instance. Some common blood pressure drugs like ACE inhibitors or certain diuretics, they've been linked to it. Infections, too. Things like mumps or even hepatitis A, surprisingly.
Huh. Infections. Never would have guessed that.
Yeah. And also really high levels of fats, triglycerides in your blood, physical trauma like a blow to the abdomen, and sometimes, ironically, complications from medical procedures.
Procedures? Like what kind?
There's a procedure called ERCP, endoscopic retrograde cholangiopancreatography. It's used to look at the bile and pancreatic ducts, sometimes treat blockages. But the procedure itself can occasionally irritate the pancreas and, well, trigger an acute attack.
Wow. So even trying to fix a problem can sometimes cause this one.
It's a known risk, unfortunately. And what's actually happening inside the pancreas during an attack, the mechanism, is pretty destructive.
How so?
Remember those powerful digestive enzymes it makes? Normally, they're inactive until they reach the gut. But in acute pancreatitis, something causes them to activate while still inside the pancreas.
Oh, no.
Yeah. So the pancreas basically starts to digest itself. That's what leads to all the inflammation, the swelling, and the tissue damage.
Ouch. That sounds incredibly painful. So what would someone actually feel? What are the warning signs if this internal storm hits?
Pain is the big one. Usually severe, often excruciating abdominal pain. It's typically steady, not crampy, and it often feels like it's boring right through to your back. That radiation to the back is a real hallmark.
Okay. Severe pain radiating to the back. Anything else?
Nausea and vomiting are very common too. And the abdomen might feel swollen, distended, and very tender to the touch.
You mentioned severity varies. How is that classified?
Right. It's generally classified as mild, moderately severe, or severe. And there are also two main pathological types, sort of based on what the inflammation looks like. There's interstitial edematous pancreatitis. Think of that as widespread swelling, like a really bad bruise inside.
Okay.
And then there's necrotizing pancreatitis. Necrotizing means tissue death. So parts of the pancreas tissue actually die off. That's obviously much more serious, much more dangerous.
Definitely sounds it. So given how bad this sounds, how do doctors confirm it's actually acute pancreatitis?
Well, the symptoms, especially that characteristic pain, are a big clue. But then blood tests are key. They look for high levels of specific pancreatic enzymes, amylase and lipase, in the blood. When the pancreas is inflamed, it leaks these enzymes so the levels shoot up.
Right. The amylase and lipase. Got it.
And then imaging studies are really important. A CT scan of the abdomen is often used. It can clearly show the inflammation, see how severe it is, and sometimes spot complications. An abdominal ultrasound might also be done, especially early on, to look for things like gallstones, which might be the trigger.
It strikes me that someone might mistake this for just, a really bad stomach ache or food poisoning at first. Is that a common issue? Delaying getting help?
Absolutely. That's a real danger. Someone might think, oh, it's just terrible indigestion, or maybe I eat something bad and try to tough it out at home. But the intensity, the steadiness of the pain, and especially that back radiation, those are signs that could be something much more serious like pancreatitis.
And delaying treatment could be bad.
Very bad.
Yeah.
Because acute pancreatitis can lead to some pretty serious complications, and not just in the pancreas itself.
What kind of complications are we talking about?
They can be local, meaning right around the pancreas. Things like fluid collections building up, or pseudocysts, which are like walled-off sacs of fluid and debris that form after the inflammation.
Pseudocysts, okay.
But the really dangerous ones can be systemic, affecting the whole body. The inflammation can trigger a massive response that impacts other vital organs. You could go into shock, develop kidney failure, or acute respiratory distress syndrome, where the lungs fail. These systemic complications are why severe acute pancreatitis has a significant mortality rate. It underscores that this isn't just a tummy ache.
Definitely not. So once it's diagnosed, what's the immediate plan? How is it treated?
The cornerstone of treatment is supportive care. The main goal is to rest the pancreas and help the body recover. This usually means, first off, aggressive intravenous fluids, giving lots of fluids through an IV. This helps prevent dehydration and support circulation, which can be compromised.
Okay, lots of fluids. What else?
Pain management is critical. As we said, the pain can be agonizing, so strong pain relief is needed. And nutritional support is important. Often, patients aren't allowed to eat or drink anything initially to give the pancreas a complete rest. Nutrition might be given intravenously, or sometimes through a feeding tube placed further down the digestive tract, bypassing the pancreas.
So rest the pancreas, fluids, pain control. What about severe cases?
For severe cases, patients almost always need to be in an intensive care unit, an ICU. There, they can be closely monitored, get support for failing organs if necessary. Sometimes antibiotics are needed if there's evidence of infection, particularly with necrotizing pancreatitis. And specific procedures might be required for complications, like draining those fluid collections or pseudocysts we mentioned.
It sounds like a really intensive recovery process.
It can be, especially for severe cases. Mild cases might resolve in a few days, but severe or necrotizing pancreatitis can mean weeks or even months in the hospital and a long recovery.
Okay, that covers the sudden storm acute pancreatitis. Now let's shift gears. You mentioned chronic pancreatitis. If acute is the storm, what's chronic? You described it as more like a slow erosion.
That's a good way to put it. The fundamental difference is permanence and progression. Chronic pancreatitis isn't just inflammation. It's persistent inflammation that leads to permanent, irreversible structural damage to the pancreas.
Permanent damage.
Yes. Scar tissue, fibrosis, forms. The ducts can get distorted or blocked, and over time, this damage leads to a steady decline in the pancreas's ability to do its jobs, both the exocrine job of making digestive enzymes and the endocrine job of making insulin. It's a progressive condition. It generally gets worse over time, not better.
That sounds really tough to live with. What drives this long-term chronic damage? Are the causes similar to acute?
There's some overlap, but also key differences. By far, the biggest risk factors for chronic pancreatitis in adults are long-term, heavy alcohol consumption and cigarette smoking. These two are strongly linked.
Alcohol and smoking. Okay. Major players again.
Definitely. But just like with acute, there are other causes too. Certain genetic mutations can predispose people. There are genes like PRSS1 or CFTR, the same gene involved in cystic fibrosis, where mutations can increase the risk.
Genetic factors. Interesting.
Yeah. Autoimmune pancreatitis is another cause, where the body's own immune system attacks the pancreas. And sometimes structural problems, like blockages in the pancreatic ducts from scarring after trauma, or maybe recurrent acute attacks, or even tumors, can lead to chronic changes.
So recurrent acute attacks can actually lead to chronic pancreatitis.
Yes, that's a really important connection. One theory of how chronic pancreatitis develops, sometimes called the necrosis fibrosis theory, suggests that repeated episodes of acute inflammation and tissue damage, even if mild, eventually lead to scarring and fibrosis. Each attack leaves a little bit more permanent damage behind until eventually you cross the threshold into chronic disease.
Wow. So they're not always separate things. One can pave the way for the other?
Exactly. It's often a spectrum. Some people might have one severe acute attack that triggers chronic changes, while others have multiple milder attacks over years that slowly cause the damage. It highlights why preventing recurrent acute attacks, especially those related to alcohol or gallstones, is so important.
Okay, so living with this ongoing damage, what does that actually feel like day to day? What are the main symptoms of chronic pancreatitis?
It's often dominated by two major issues. First, chronic abdominal pain. This can be really debilitating. It might be constant, a nagging ache, or it might come in episodes of severe pain, similar to acute attacks, but perhaps less intense or lasting longer. Managing this pain is a huge challenge.
Constant or recurring pain, that sounds awful. What's the second main issue?
Symptoms related to the pancreas failing at its jobs, what we call pancreatic insufficiency. Because it's not making enough digestive enzymes anymore, people develop malabsorption. They can't properly digest fats, leading to symptoms like steatorrhea, which is bulky, greasy, foul-smelling stools.
Oh.
This malabsorption also leads to unintentional weight loss and deficiencies in fat-soluble vitamins A, D, E, and K because you need fat to absorb them.
So digestion problems, weight loss, vitamin deficiencies. What about the insulin part?
Right, that's the other side of the coin. As the endocrine function declines, the pancreas struggles to produce enough insulin, so many people with chronic pancreatitis eventually develop diabetes mellitus. It's sometimes called pancreatogenic diabetes or type 3C diabetes.
So you could end up managing chronic pain, digestive issues, and diabetes.
Unfortunately, yes. That's the reality for many people with advanced chronic pancreatitis. It significantly impacts quality of life.
How do doctors approach diagnosing something that develops slowly like this and then managing it long term? It must be quite different from spotting an acute attack.
It is. Diagnosis can sometimes be tricky, especially in the early stages. Advanced imaging is key. MRI scans, or a special type called MRCP, magnetic resonance cholangiopancreatography, can show the structural changes like scarring, duct dilation, or calcifications within the pancreas.
MRCP, okay.
Endoscopic ultrasound, or EUS, is also very sensitive for picking up subtle changes. And sometimes, specific pancreatic function tests are needed. These might involve collecting pancreatic juices or doing breath tests to measure how well the pancreas is actually working, how much enzyme it's putting out.
So more sophisticated tests to see the long-term damage and functional loss.
Exactly. And once diagnosed, the treatment is really multifaceted and long-term. A huge focus is on managing that chronic pain, which can involve various medications, sometimes nerve blocks, or even endoscopic or surgical procedures on the ducts.
Pain management is central.
Absolutely. Then there's tackling the malabsorption. This is done with PERT, pancreatic enzyme replacement therapy. Patients take capsules containing digested enzymes with every meal and snack to help break down food.
So they take the enzymes the pancreas can no longer make.
Precisely. It can make a huge difference in reducing fatty stools, improving nutrition, and helping regain weight. Managing the diabetes, if it develops, is also crucial, often involving insulin.
And what about lifestyle? You mentioned alcohol and smoking are major drivers.
Lifestyle changes are absolutely critical. Complete abstinence from alcohol is essential, as continued drinking will worsen the disease. Stopping smoking is also vital, as smoking is an independent risk factor and seems to accelerate progression. Diet modifications, like eating smaller, more frequent, lower-fat meals, can sometimes help too.
It sounds like a very demanding condition to manage.
It truly is. And unfortunately, there's one more serious long-term risk we have to mention. People with chronic pancreatitis have a significantly increased risk of developing pancreatic cancer later in life. The chronic inflammation seems to create an environment where cancer is more likely to develop. So surveillance for cancer might be part of long-term management for some patients.
Wow, that adds another layer of complexity and concern. So pulling it all together, we've seen the spectrum from the sudden acute storm to the slow chronic erosion and how they can even be linked.
Exactly. You can see how recurrent acute insults, especially from things like alcohol, can literally pave the way for irreversible chronic damage. It really underscores how interconnected things are within the body.
So, thinking about our listeners, after going through all this detail about acute and chronic pancreatitis, what's the big aha moment? What's the key thing you hope people take away about their own bodies?
I think maybe two things. First, just the deeper appreciation for the pancreas itself. It's doing these incredibly vital yet very different jobs, digestion and blood sugar control simultaneously. It highlights how one organ can be central to seemingly separate health issues like gut problems and diabetes.
Right, the connection piece.
Yes. And second, and this is maybe the more sobering takeaway, is how much our lifestyle choices can impact these vital hidden organs. Particularly with alcohol and smoking, the link to both acute and especially chronic pancreatitis is just undeniable.
Yeah.
It's a stark reminder that choices we make can have profound, sometimes irreversible consequences down the line. The body has limits.
That's a powerful point. Understanding the why behind recommendations like limiting alcohol or not smoking becomes much clearer when you see the potential damage to an organ like the pancreas. Well, this has been an incredibly insightful deep dive. We've really unpacked the differences, the causes, the symptoms of both acute and chronic pancreatitis. Understanding this complex organ, I think, really does give you a new perspective on your overall health, doesn't it? And all the intricate things happening inside us without us even realizing it.
It really does. And perhaps a final thought for everyone listening to consider is the body's amazing resilience, but also its vulnerability. Your body often gives signals, little whispers before things get really serious. Maybe it's occasional indigestion after drinking. Maybe it's mild abdominal discomfort.
Hmm.
Learning to listen to those signals, understanding your personal risk factors, whether it's family history, lifestyle, or other conditions, that can be incredibly empowering. Recognizing early signs allows for earlier intervention, which can make a huge difference, especially in preventing the progression from acute issues to chronic damage. It really is about learning to listen to what your body might be trying to tell you.
Learning to listen. That's a great takeaway. Don't ignore the whispers. Well, we hope this deep dive has sparked some curiosity and maybe encouraged you to continue your own explorations into health and well-being. There's always more to learn about these amazing bodies we live in. Thanks for joining us on the deep dive. Until next time, stay curious, stay informed, and keep exploring.